Aeromonas smells like SeaWorld on a bad day.
I remember sitting in that lab and you were like,
I had to shut it. I was like, this is awful.
Hi, my name is Ashley Justice.
Christopher Swartz.
Kylie Chaffin.
Hadley Scott Clark
I'm a student in the Medical Laboratory Science program here.
at the University of Kentucky's College of Health Sciences.
Medical laboratory scientist is a scientist who works typically in a laboratory in a hospital.
We specialize in lab testing.
We're kind of the unsung heroes of the hospitals that help doctors diagnose the patients.
Any blood that's drawn, any urine sample, any body fluid really, will always come to the lab, and we're the first people to see it. We're the people who give that specimen and the results back to the doctors so that the patient can get a proper diagnosis.
I chose MLS because I've always wanted to work in the health professional field, and I wanted a degree that I could get in 4 years and get out and make a decent salary and work with people.
Personally, I want to go on to be a doctor, so I chose this major because it allows me to stand out from the rest of the applicants.
I thought if I learned the pathology behind the diseases in the lab tests, it would help me better be prepared for medical school.
I worked in a research laboratory affiliated with the university for many years. And I just got to a point where I wanted to do something more meaningful and worthwhile, something that actually had a benefit in other people's lives.
On day one, we started working with real patient samples. So we started working with real patients almost immediately in the program, and you don't get that in any other science program.
In the laboratory, everybody's pretty much independent and is responsible for completing their own laboratory exercises.
Blood bank, it's very hands-on. You get to do the antibody panels. Microbiology, I like it because you get to open up a plate, and look at it.
You are cross-trained in a number of sciences, so when you come out, you will essentially be a jack of all trades.
And I learned better hands-on, and half our classes are in the lab, so I learned a lot better that way.
That's what you'll be doing in the real world, in those labs, in blood bank, in microbiology, in hematology.
We're a very small class, and we're a very close-knit class.
We can help each other with homework and studying, and it makes it a lot more fun in class.
We all spend time with each other on our lunch break. And then also we have like a group message outside of class that we mainly use for like homework help, but every now and then it'll just be like stupid stuff.
You get really close to your teachers, and they truly do care about you.
They're funny, and they've really made an effort to get to know us.
We get to the slide of really bad cancer and she goes, look how cute they are. That's Miss Campbell's favorite word. It's cute.
Yeah.
Cute, yeah.
We can go to them with anything. Even if we just want to talk, we can go to their office hours.
They will help you in any way they can, and it's really nice to have that to fall back on, to know that if I need help with something, I can always either call another student or email a teacher, and I'll always get feedback.
The most challenging part of the MLS program for me has been adjusting to the volume of information that we're constantly bombarded with on a daily and weekly basis.
In the beginning of the year, it was a little hard with all the studies we had to do, but you really learn to manage your time well in the program.
Every Wednesday at 8:30 a.m. when we walked into that blood bank lab, I was like, well, this is gonna be a really hard 4 hours. That was challenging.
But at the end of the day, I've got to study and I've got to make the grades so I can be a good healthcare professional.
So for a potential MLS student, I would definitely tell you to stay focused, stay driven.
Be prepared. It's not easy.
It's a fantastic program. You will make so many friends.
If you have an interest in biology or chemistry or medicine in general, I think that the medical laboratory science program will quench your thirst in any of those areas.
It's a lot of work. There's a lot of studying involved, but it's worth it.
Just enjoy the ride.
We want you to be an MLS.
I figured the hand gestures were optional. I don't know. I didn't know. It didn't matter.